Welcome back to our channel. Today we have a psychiatrist, Dr. Clifford Sussman, and we're so excited to have his expertise and insight. Dr. Sussman is a child and adolescent psychiatrist who evaluates and treats people of all ages with excessive screen time related problems. As an author of peer-reviewed literature and a frequent public speaker and expert consultant, he is a leading expert on internet and video game addiction. He is dedicated to helping people achieve a more balanced relationship with technology. Dr. Sussman is a pioneer in recognizing and treating internet gaming disorder since 2008, long before it became recognized by the World Health Organization as an official diagnosis. He is a frequent educator and presenter on this topic and trains other clinicians as well. As a programmer, software developer, and gamer himself, he is dedicated to helping people achieve healthier, more balanced relationships with digital technology. Dr. Sussman has completed residency training in adult psychiatry at the University of Pittsburgh, Western Psychiatric Institute and Clinic, and a child and adolescent psychiatry fellowship at George Washington University, Children's National Medical Center. He has completed an adult psychodynamic therapy fellowship at the Washington Center for Psychoanalysis and a child psychodynamic therapy fellowship in the Baltimore Washington Institute for Psychoanalysis. Dr. Sussman is certified by the American Board of Psychiatry and Neurology. Dr. Sussman went to medical school at SUNY Upstate Medical University, where he achieved the Academic Achievement Award in Psychiatry. Dr. Sussman has received a BA in Psychology from Vassar College in Poughkeepsie, New York. Dr. Sussman, so excited, and thank you for taking your valuable time and devoting it to helping and sharing. Thank you so much for joining us.
It's my pleasure. Thanks for having me.
So, wow, what a bio. And I'm going to deviate a little bit from our questions.
Yeah, you gave a very detailed version of my bio.
You know, it's good for
You read my whole website, but that's okay. I can give you an abridged one if you want it. But, yeah.
Absolutely not. People need to know your expertise, right? Because
all right.
You were able to see before anybody that video game addiction and media addiction was a problem back in 2008, before the WHO, before the American Psychiatric Association. You know, you were way, way ahead of the game. So as a psychiatrist who specializes in mental health for both adults and children, can you just summarize why video games are addictive? And when does a hobby cross the line into an addiction?
So when do video games become addictive? It's really when they start causing problems. So if you go to the basic definition of addiction, it's when whatever you're using, it's not only that you're using too much of it, it's that the using too much of it is causing problems in your life, mainly functional problems, like academic problems, social problems, family problems, psychological problems, medical problems. So that's sort of the general definition of addiction. It's not really defined by how much of something you use or how many hours you're using it. It's defined by the inability to stop and the problems that causes. And so when I first set up shop back in 2008 as a private practice psychiatrist, even back then, families would come in and say, parents would say, my kid's addicted to video games, right? And I was getting college dropouts from their first year, where they just couldn't handle the lack of structure and were on screens all the time. And so I was seeing patients like that, and when I would hear the parents call it addiction, even though like you said, it wasn't an established diagnosis, it sort of clicked with me that that screens do have this, that are very hard to get off of from my own childhood. I knew that from gaming my whole life, and so and I had a tendency to want to like not stop until I completely finished the game if I was playing some big adventure game. So yeah, so I said, maybe there's something to this. And when I actually evaluated the patients, I saw that they were having some of the same symptoms that I would see on my addiction rotations and training. When I worked with cocaine addicts or heroin addicts or, people with alcohol use disorder. And so, it really started to make more sense to me. And then I started looking at a lot of studies that in peer-reviewed literature that were showing the brain biology of people with drug and alcohol addictions, and then people who had used screens excessively. And I did a review article that discussed what I thought was going on biologically and kind of compared and showed a lot of overlap. And so that's when, I would say it was around like maybe 2017 or maybe 2018 when I decided that I was getting so many cases like this that I decided to make that the focus of my practice. I decided to make it so all my new intakes had some kind of excessive screen use problem as part of their presentation. And so that's been the main focus of my practice. But I was really treating a lot of the same things I was treating before, because kids, the typical cases that a child psychiatrist gets: autism, ADHD, depression, anxiety. There's a ton of overlap between that and excessive gaming. So, so I was still treating a lot of that as well, and doing a lot of combined psychotherapy and medication like I typically do for those things. But I was adding in therapeutic techniques for, really designed towards addiction.
So back to, gaming or technology use has to be a disruptive thing before we call it an addiction. So you would say that and agree that a professional gamer who has a 40-hour work week, and that work week involves, playing games, that doesn't necessarily fit the definition of addiction if that playing of games is not a problematic thing, right?
Exactly. I've actually worked with professional gamers over the years. Like, I've had a couple patients who were professional gamers here and there, and yeah, the focus of treatment was not to get them to stop being professional gamers. It was actually to help them be better professional gamers by being able to take breaks when they needed to, and being able to get off screens when they weren't working.
Oh, that's amazing. And in your perspective, okay, you're also a gamer and a programmer, which I think is fascinating because a lot of doctors don't have that type of skill set. From your perspective of a gamer and a programmer, did that help you connect with your patients, number one, and then also understand their struggles more deeply?
Absolutely. I mean, it like I said, I had a very tough time getting off of video games myself growing up. And plus I'm just so fascinated by the whole world of interactive multimedia. And I wanted to be able to develop interactive multimedia myself and make my own games and animations. So I trained myself in those areas. And I guess just being a computer geek in general just helps you to connect with some of your patients. And then, you know, I should also add that while it has helped me to, while my own experiences have helped me to connect to my patients, I've also had to really stay up to date and current on the gaming world because it's evolved and changed a lot. Games are not Games are very different from what they were when I was growing up. So all digital technology that becomes addictive has some things in common, which we can talk about. Like, they're all instantly and continuously gratifying, but modern day video games are much more multiplayer focused. Massive multiplayer online games are the most addictive games and the most common games that kids play now. And so, kids, and we're talking about anything from, Fortnite to Roblox to Call of Duty to Minecraft. You know, the the line, but the games have become more open world, and they become more customizable and more user created. Right, the content is user generated, which has really expanded the world a lot. And it's also that the line between like social media and gaming has gotten very blurry. Gaming is very social now, and social media is very gamified.
Yeah, that's very interesting because Nick Yee, PhD, did a research study where he asked, like, I think over 20,000 gamers, and they said that the three things that make it addictive or enticing for them in a game is one, achievement. So that's like the high score, right? The immersive
Mhm.
world. And then the third part is the socialization, which adds that element of excitement. And I've seen that too. When people play
Yeah,
Fortnite, for example, there's a lot of peer pressure to buy skins, to
yeah,
actually, if you don't buy the skins
absolutely.
and you're wearing the default skin or outfit, for those who don't play, Fortnite, they're like digital outfits. You can dress up like a
Yeah.
Star Wars figure or a Spider-Man or whatever.
Mhm.
And if you're not wearing an outfit, you can actually be booted out of a social
Sure.
group. And so that's the peer
Yeah.
pressure. So what does
Oh
that
yeah,
do?
well, like let's think of like peer pressure and FOMO, fear of missing out. That's always been a big factor in addiction long before there was digital addiction. It's the same thing with, when your friends are using a substance that you want to try. So, but it's just gotten evolved even more.
Yeah. So do you find that to be a common problem amongst the
Yeah.
kids that you treat?
Well, yes. I mean, there's very few like recent cases of addiction that I've gotten where the gamer wasn't doing some kind of social gaming. And so there's definitely like, the need to socialize is a big factor. And it's not even just addiction because I work with a lot of kids in the spectrum, and the fact that games are social, it lowers it levels the playing field for them and makes that so that like their difficulties, for example, making eye contact or reading nonverbal cues, they go away when you're doing all your socializing, chatting while playing a video game. And all of a sudden you can become popular. You had mentioned before about how people compete and they level up, like they get this sense of mastery in games, right? And some of the kids who may not have mastered socializing in the real world might really master these games and the gaming world and might be very popular in that, which makes it really hard to leave that world.
So would you say that that's good for a child on the spectrum with autism and Asperger's, or do you think that it can actually hinder their development if they are playing excessively?
Well, I think that what's good or versus bad is not the content or what they're doing itself. What's good versus bad is again how it's affecting their life and how much they're doing it. So it could be a very good thing, right? If they're having social opportunities that they wouldn't have in the real world. And it could be a way for them to form connections, although I would caution people that the connections you form online can be very different than it's just a different form of socializing than what you do in the real world, which is not to say it's better or worse. It's just different. And it may not be one may not be a replacement for the other. But what happens is that you can get too much of a good thing, right? It's like when they can't get off, when they can't go back into the real world, when they can't have a real world social life because they don't spend any time developing the skills they need. And I would also add that aside from the social problem, there's also the problem that kids in the spectrum can go online and get all the content they want related to a topic that maybe they're fixated on. And they may have a very repetitive style of like watching YouTube videos, for example, over and over again, the same ones. And that may be something that they need to work on to function better in real life, and it kind of could just feed that problem.
Yeah, you're absolutely right. There's a YouTube channel where this guy made a channel just filming elevators going up and elevators going down and just basically elevators. He has millions of subscribers. He's monetized and does very well. He didn't know why people are so interested, but it was a group of autistic people. You know,
Yeah.
literally millions of autistic people went to that
Hmm.
channel who love to watch elevators. And because they're
That's
watching
amazing.
elevators all the time, they are now, as you mentioned, excessively, they won't get off, they won't,
Yep.
live life. And so now that
Hmm.
impairs the other developmental milestones for them,
Hmm.
such as socialization or eye contact or communication. So that has become a problem for these autistic
Yeah.
population. But very
Yeah, well,
fascinating.
it's yeah, I mean that talking about videos of elevators, that just brings back a lot of memories for me because I have a daughter with autism, and when we figured out that she was autistic at a very, very young age because she wanted to go up and down elevators all the time and just press the buttons. Um, so yeah, that's that I mean, but although I think all kids will watch videos of uh things that you wouldn't believe they'd be interested in or entertained by. For example, both my kids would like watching videos of people opening up chocolate eggs with prizes inside. And so they'd just be looking at a pair of hands on YouTube Kids, like opening up a chocolate egg and taking a prize out of it. And you could watch that forever. I'm like, what's the draw? But when you think about it, that's kind of like a slot machine. It's like it's got that what we call in behavioral psychology, that variable ratio reinforcement, that unpredictability. So you don't know what's going to come out of the next egg. And that's the draw. And you can have kids not in the spectrum, like watching stuff like that for hours.
So, as a programmer, one who's familiar with the tricks of the trade, do you think this is intentional that these games are designed this way?
Well, I can't read the mind of the creators, but I have to imagine that they that that they they're either getting the feedback that it works and so they're doing more of it, or maybe there's something more nefarious to it where they're studying behavioral psychology and learning. I mean, look, at the end of the day, you got to keep your users on, right? So you're going to do whatever you can. It's a business, it's an industry, and I'm sure that bigger companies know more tricks about how to keep people on. And look, that's the focus of it. That's why I think we're all kind of functionally dependent on technology for so many really important practical everyday uses. But so it's easy for, a developer to, to find people online and to find everyone online. And I mean, I think that what sells is they're gonna have more of. It is an industry. And sometimes there'll be something like educational software that's where parents will be like, okay, my kid can do this because it's got all safe content, and it's going to help them learn. Well, again, too much of a good thing, right? If the software is designed, like most software, all software, I would think even most educational software is designed to keep kids on in addition to whatever its main purpose is. So that means that you can have a kid getting addicted to educational software, if it uses enough of those algorithms and tricks and, for keeping people on. And, again, it becomes an addiction when you're on it, when you can't get off when you need to, regardless of how beneficial the software may be and it's when it's used properly.
So it sounds like you definitely agree that this is a medical issue. How big of a medical issue is this? This addiction to games and media and technology. What's the scope? I mean, like some papers have shown, oh, it's only a few people, maybe less than one half of 1%. And so you don't have
Yeah.
to really worry about it. Or is this like a tsunami of mental health problems and it's going to keep you super busy? You should know because you're on the front lines and you see what's coming in your doors.
Well, it certainly keeps my practice full. And so much to the point where I feel like the demand for help with this problem is way more than the supply of people who can help with it, which is why I devote my career also to doing shows like yours and to, trying to educate the community and also trying to train other clinicians so there's more people who can take on these cases. if you look at literature, there's a huge range of epidemiology, claiming that, oh, it's 1%, it's 10%. There's a lot of debate over what percentage of kids have some kind of screen addiction. But I actually can tell you pretty much the reason for that. The reason goes back to the definition of addiction. We said that it's defined by the problems you have, right? So anything that's defined by problems is going to be a continuum. You can have severe problems or you can have mild problems, right? So if a study is testing for just the kids who have the most severe problems, like they've dropped out of school, they don't sleep at all, they're suicidal, stuff like that, it's going to have a smaller percentage, percentage of the population. If the study is going for kids who just have had their grades drop, or just, if it's including more criteria or milder criteria, then sure, it's going to have a much higher percentile. But either way you look at it, it's screens are everywhere. We're saturated, and really society has changed in the digital age in many ways. We kind of accept as norms things today that we never would have before we became so digital. And that makes it hard to tease out how much of a problem it is for some people.
Absolutely. And I agree with you. And so because of the problem, what are practical advice would you give to families trying to set healthier digital boundaries at home?
I think some of the keys are structure, having, a lot of time spent doing structured offline activities. I actually like to separate the types of activities kids do into high dopamine activities, which is the way I've defined activities that are instantly and continuously gratifying. So all these online activities that kids can't stop doing, it sort of ties them all together: the gaming, the social media, the Netflix, the streaming services, all that stuff. And then low dopamine activities, which are activities that require patience and where you need to wait to get what you want, because those activities are going to cause less dopamine flow comparatively in the brain. So basically what I try to get parents to do is give their kids a balance of high dopamine and low dopamine activities. So to do that, again, requires a lot of structured activities that are low dopamine. Get your kids involved in after school activities, sports, clubs, martial arts, Dungeons and Dragons, anything that's like, that takes more patience and is off a screen. And while doing homework and doing exercise, those are great low dopamine activities. They're not structured activities, right? So they're not like on a schedule from a certain time to a certain time. So they're not going to work as well to keep your kids off a screen. So that's the biggest thing, is structure. Then I also have families pay attention to environment. What are the cues in a child's environment? When you walk into a room filled with devices, it's going to be very hard to sit there and do homework. It would be like drinking water in a bar. The brain gets primed to do activities related to the cues in your environment. So I have parents be very mindful of the types of cues that are in the home environment, and maybe do a separate area for, online, for, low dopamine activities, and a separate part of the home for high dopamine activities. And maybe if you have a young child and you have a room set aside with all the devices charging in it, where they stay there when the kid leaves the room, then that could reduce a potential power struggle, because instead of the parent having to get a device out of their child's hand, they might be able to get the child out of that room and to do an activity that's elsewhere. Plus, you're separating the devices from where you sleep, and where you eat and things like that. So we mentioned structure and environment. And then the third thing, I think, is just trying to limit, time limit blocks that you're online, that you're doing high dopamine dopamine activities, even if you don't have a structured activity. Maybe, for example, try to make the standard block of time 45 minutes or an hour, depending on the age of the kid. And then they have to take an equal length break of low dopamine activities for every block they're on. So those are just some of the tricks that families can use. And, in some of my talks, I go through a lot more of them. But those are some of the big ones that families have found helpful.
Yeah, I think that's going to be very helpful for people who are watching. And for those who are watching, there's been a lot of debate on whether video games are truly affecting the mental health of kids. What does the science actually say about the mental health impact?
I think there is a lot of literature that strongly supports the idea that excessive gaming is contributing to you know all sorts of problems in kids' behaviors. It's not the only contributing factor, and there may be baseline factors that put them at more risk of developing that problem. But it then becomes like the elephant in the room when the child goes into the psychiatrist and the parent is like, he's my kid's just having all these problems. And if the psychiatrist says, well, he's got ADHD or he's got anxiety, and if we just treat that with medication or therapy or whatever, what usually happens is that if you don't address the gaming addiction as well, you're creating a barrier to treatment, and these kids don't get better because you're not addressing that elephant in the room. And I think it's so important to address the gaming habits up front. I think kids go into a state of what we would call reward deficiency syndrome in the literature, where they're on screens for so long that they become desensitized to the dopamine they're getting from it. And as a result, they become more bored and more irritable when they're off a screen. And if they have a condition already like ADHD that makes them more prone to boredom, they're even more vulnerable.
And you've trained a lot of clinicians around the world, right, to recognize and treat internet gaming disorder. What do you think is missing for most of these mental health practices when it comes down to digital addictions and their understanding of this disorder and how to treat it properly? Because you mentioned a few. If you don't take away the games and you just treat the ADHD, it's not going to help the child. So in your opinion, what's missing in most of these mental health practices?
Well, I mean, some probably don't even do the basic screening for it, and I think more clinicians are catching on to the importance of doing a screening for screen use, Yeah, so screening is very important. And like in my residency training and my fellowship training, there was nothing on this. We didn't get training at all in excessive screen use. So a lot of the knowledge that I was applying towards it when I started to treat it was knowledge I'd learned from, again, treating other things that they teach us to treat related to addiction, like other use disorders. So, I'm hoping that as, we've already got gaming disorder in the ICD-11. Right now, doctors are still using the ICD-10, so so you can't even bill for it yet. So I'm hoping that evolves. I'm hoping that, and by the way, I'm hoping that the diagnosis gets expanded, because just gaming disorder doesn't account for social media and streaming videos, and and it's all sort of interconnected. It's all got the same sort of final common dopamine pathway. And really, I mean, when people are addicted to, let's say, watching YouTube all day, they may just be watching YouTube of people playing the games they play. So, that diagnosis of just gaming disorder doesn't make that much sense in reality. The only reason they use it that specifically is because that's where most of the research is now. So that's kind of like comes before the diagnosis becomes official. So yeah, so doctors are even missing sort of like, diagnostic criteria and labels for these problems, and clinicians are. But like I said, they are getting better at screening for excessive use. I think that I'm hoping that this is going to be part of training programs in the future for all clinicians.
So, in terms of training programs, if you're going to focus on treatment,
Mhm.
you are actually well trained in psychodynamic therapy.
Mhm.
And can you talk a little bit about how you use that as well as
Yeah.
medications,
Mhm.
treatment approaches for digital
Right.
addictions, especially in children and teens?
Sure, sure. And since you mentioned children and teens, I would say that with younger kids, I'm doing more work with the parents, on managing for managing screen use with their younger kids and strategies for parenting these things. But I do that with the parents of teenagers as well.
Hmm.
And young adults too, if they still live with their parents, which is very frequently the case. But yeah, so to answer your question about dynamic therapy, um, so just to sort of give people a little primer on psychotherapy in general, there's psychodynamic therapy is a, a type of psychotherapy designed to kind of really listen to people and connect with them and bring out what's in their unconscious mind. It was um, developed from psychologists like Freud. Um, Whereas there's behavioral therapies and evidence-based therapies like cognitive behavioral therapy that are more based on um, using manuals and doing exercises and doing homework to try and train yourself. Now, a very helpful type of psychotherapy that I found in my practice is called motivational interviewing, which is actually kind of a cross between the two. And it was really developed for treating addiction, but also works in general very well for patients who are ambivalent, meaning they're torn in multiple directions. Um, Sometimes that's a nice way of saying resistant. They don't want to be there. So I obviously, because I'm getting a lot of kids brought in by their parents for using too much screens, many of my patients are ambivalent about whether they even want to be in my office in the first place. So motivational interviewing lends itself very well to that. And like I said, it was developed to treat addiction. What you do is you help people explore the things that are keeping them in this problematic behavior, and you help them explore what motivations are possibly pulling them out of it, and and you try to help them navigate those waters. But I think one of the most important things about motivational interviewing is that rather than being just another authority figure or parental figure in the child's life, I'm helping them to become their own authority figure. It's a very open-ended, non-judgmental form of psychotherapy where you're really having the patients tell you what needs to change rather than just, telling them what they need to do, which will often just get them to do the opposite.
For parents with an addictive gamer in their household, what would you recommend the first step be?
Well, I think that, once you start getting some of those red flags we were talking about before, like maybe aggression or maybe, not, not sleeping or threatening to want to harm themselves if their games are taken away, red flags like that. I think that's when, it's important to bring the child in for an evaluation, ideally a psychiatric evaluation. Um, and hopefully from a psychiatrist who has some background in this and has some training. Um, and there are other types of clinicians who have training in this too, such as psychologists and pediatricians and social workers, but just try to make sure they have a little bit of a background in how to deal with this. Maybe ask them about their approach. But there are cases where you may need to take a kid to like a psychiatric emergency room if it's that severe an issue. But hopefully you can eventually find your way. A lot of it's about figuring out what kind of placement is appropriate when it comes to treatment. Some kids need to be in residential centers if it's severe enough, until they've gotten things under control enough that they can be treated in an outpatient setting, whereas others can do quite well in outpatient.
Wow, this has been incredibly enlightening. And for those who want to get in touch with you or learn more about your work, where should they go to find more resources and connect with you?
Well, my website is the best place to go, www.cliffordsussmanmd.com. That's CliffordSussmanMD.com. I try to put a lot of educational information on that website, and it also has ways to contact me, as well as some resources for mental health professionals.
Thank you so much for joining us today. I think this is amazing to have a psychiatrist who has this much understanding about gaming addiction, who's been ahead of the game since 2008. So it's a very huge honor to have you here to share your expertise and to validate what you and I have seen to be a problem. And it's a growing problem out there. And thank you so much.
It's my pleasure. It was good talking to you. Good luck with your program.
Thank you so much for joining us today. If you like this video, please remember to like, share, and comment. And also remember to hit the subscribe button so that you get notifications of our future videos. Until next time, have a wonderful day.